right. Good evening, everybody. Um, my name is Halleck Ravel Nelson, and I am the new health commissioner going on 2 months. I will say that I am truly, as I was thinking about this meeting, I am truly humbled to be in this role. I have worked with the Board of Health and come up through the ranks of the health department. So have been a part of many Board of Health meetings and amazing regulations and the full-on process of the regulatory capacity of the board. So being able to serve in this capacity is both amazing and humbling. And I just wanted to make that acknowledgement for the record. Um, I'm going to go ahead and call the meeting to order and just take a quick roll call. Dr. Scott McNeil, I believe he's present. Dr. Gold.
Here.
Dr. Tyra Bryant-Stevens.
Here.
Dr. Ahmed Ishmael. Dr. Jennifer Ibrahim.
Here.
Dr. Anadise Wu.
Here.
And Dr. Ushma Bilal.
Here.
Great. Before we get into the presentations, I would just like to ask the board members if they've had time to review the last meeting's minutes. And if I have a motion to approve the minutes.
So moved.
Second.
All in favor of approving the minutes?
Aye.
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 The ayes have it. At this point, I'm going to ask Ben to explain the public comment process and the steps associated with it is a public meeting, folks being able to provide comment.
Thank you, Dr. Val Nelson. Good evening, members of the public who are joining us. My name is Ben Hartung, and I'll help facilitate the public comment process tonight. The board will take questions after presentations through the chat function in Zoom or by sending me an email directly. My email is benjamin.hartung@phila.gov. I will drop that in the chat for you. So you could send me an email or chat your question to me, and I will just disclaim that the board is not required to engage directly with your comment, but if it's submitted, that it will be read into the record. And I also need to disclaim that this meeting is being recorded per city ordinance and will be posted on the Philadelphia Department of Public Health's YouTube page subsequent to this meeting. So your participation in this meeting is consent to be involved in that video recording. Thank you very much. Back to you, Dr. Ravel Nelson.
Great. Thank you, Ben. May you please share the slides?
Yes.
Take us through. I wanted the board and the folks attending to get an understanding of not only the department, but also give you some details or insight into my leadership style and kind of what are our priorities or decision-making processes, and how we communicate, collaborate, and then how we can engage with the board. So next slide, please, Ben.
Yes. Everybody's able to see. I just want to confirm everybody can see my screen, but I guess you can. Thank you.
Okay. So essentially our agenda is just going to be a background on PDPH. I want to go over our programs, our approach, our priorities, roles in collaboration, the Philadelphia Department of Public Health and the mayor's vision to making the city the safest, cleanest, greenest, and economic opportunity for all, and where that kind of aligns with the way we make decisions in the department and the things that we want to carry out together. Next, please. So the background is essentially the mission of the Department of Public Health is to protect and promote the health of all Philadelphians. I emphasize the word all because I think we need to hear that now more than ever. And to provide a safety net for people who are disproportionately impacted by societal factors that limit their access to healthcare and other resources necessary for optimal health. Health is human rights. Without health, you cannot have human rights. And as public health practitioners, it is our job. We are charged with making sure that we take care of all the folks, all Philadelphians, but especially those that may or may not have a voice. And essentially, public health touches everyone's life every day. And I'll explain more about what I mean by that. As far as how we are structured, we have our operational divisions. So we have our environmental health services, our air management services, our division of disease control, which also captures and houses our preparedness unit, our division of HIV health, formerly known as the AIDS Activity Coordinating Office, our division of chronic disease and injury prevention, maternal child family health, the medical examiner's office, the public health lab, ambulatory health services, and our substance use and prevention and harm reduction. So these are the programmatic divisions, and they each have, individual division directors and team and staff that carry out the division-specific mission, which then follows up or falls in line with the overall health department mission. And then we have our administrative divisions. So we have our fiscal and finance, which handles all our budgets and contracts and revenue. Our health human resources. So this is our HR arm. The health department has their own HR division. Our health information technology and informatics. They protect us from all the data breaches and everything else, and make Zoom and Teams work. Office of Facilities Management and Fleet Management, which essentially goes to making sure that our health centers and our city-owned buildings are in line with the type of facilities that our patients deserve to be in. As we were planning for the build out of our 2 new health centers, one of the folks in the audience kept commenting that I wanted the health centers to be, similar to the Taj Mahal of health centers. And actually, as the health commissioner, that's what I want. I want all of our health centers to be as in line so that all of our Philadelphians can receive the best care, so that the facilities are in good repair. They're inviting, they're comforting, and they're solid places where people can come and receive health care. Our policy and communications area, and then our health commissioner's office admin team. Next, please. So the top causes of mortality in Philadelphia, we look at our data in 2 ways. The total number of deaths, and then we also look at the years of potential life lost, or the YPLL, calculated based on years lost prior to age 75. And, this kind of goes into this notion, and the mayor's quite often said about not only surviving, but thriving. We want Philadelphians to thrive. We want them to have access to the safest, healthiest sorts of food, healthcare, green spaces. We want folks to have housing security so that they're not, living in a space where their child is getting lead poison. So we want folks to be able to thrive. The top causes of death in our city are heart disease and cancer. And the top causes of years of potential life loss are accidental overdoses, homicide, and heart disease. Next, please. PH programmatic priorities. So what are our priorities based on this information? Again, we want to ensure access to comprehensive primary care. We are in the process of addressing the longstanding lack of access in the lower Northeast by building our 2 new city health centers as FTCs at at the Frankfurt Transportation Center and Friends Campus. Our goal is to improve the health of Philadelphian children through an environmental health approach. For those of you that are not aware, I'm an environmental scientist by practice. That has been my training. My doctoral degree is in environmental health and policy. And I'm a big proponent of having places and spaces where people feel safe and have clean, clean indoor air, and access to all of the things does end up improving their health. And especially as it pertains to children, we want to look at things like asthma and lead poisoning, et cetera. Maternal mortality, this is also key for us. How do we help moms and families stay healthy throughout the course of their, pregnancy and birth? Collaborate across city departments to take a public health approach to gun violence. And that is a big key for us. Decrease overdose deaths, the majority of which now involve stimulant, usually with an opioid. Continue to reduce smoking rates across the city. We know that tobacco use is a major modifiable risk factor for heart disease and asthma. And we know the tobacco industry has come up with all sorts of new ways to hook people at younger ages. And so we have to do what we have to do in order to ensure not only education, but also enforcement. Having an equity-focused emergency preparedness, incorporating the lessons we learned from COVID. Next, please. So these are just some demographic changes that I wanted to share in our city. And we've had growths within our minority communities and changes in where people in poverty live in Philadelphia. And we can see that the graph has kind of shifted towards the section of the city that would be deemed the lower northeast. So we can go to the next slide, and that'll be important in a few minutes. Again, gun violence rates in the city of Philadelphia. And this is on the left is the percentage of people unemployed by census tract in Philadelphia. And then on the right is the count of non-fatal shooting victims in Philadelphia. So we can start seeing some correlations and links, and that can only happen when we take time to work with other city departments and other agencies. Next, please. So this map takes us into, and if we did an overlay, we could see that we really need, as poverty and things change and the demographic makeup changes, we really need to address the public health primary care desert in the lower northeast. So if you look at the map, there's a lonely little turquoise dot in the northeast top section of the city. That is our Health Center 10 on Cotman Avenue. The average wait times for an adult is a year, and for children, 6 months, and that is not acceptable. And that is why we've been working so diligently, my predecessors and for years, the prior commissioners' offices have been working to put away money to make sure that we are aligned and in a place where we can build out 2 brand new health centers in the lower northeast section of the city to provide primary care. Next, please. %93 of Philadelphians are served by the city health centers, and they're people of color. And so we need to make sure that we are providing equitable service across the board, and that the care and service provided is comparable to care and service that would be received anywhere else. Next, please. That then leads us to our environmental justice and our children's asthma and lead exposure. And we know that when a child has an asthma flare-up, and asthma impacts Black and brown communities disproportionately, that not only does the child miss school, it impacts learning, but it also impacts the caregiver, the parent's ability to go to work. And so it ends up being a relentless cycle of, you know, children missing school and parents not being able to make income because they have to miss work. And the other graph here is the lifetime lead exposure by age 3. And no child should be lead poisoned. We've been battling lead poisoning for decades now. And while we passed the lead law, and then it was revised in 2019 and went into effect in 2020, requiring all rental properties to have a lead safe and lead free certificate. And we are seeing an impact of that. That is more of a primary prevention solution, and we're seeing an impact of that. But we are also spending a lot of time, our Environmental Health Services Division spends a lot of time having folks go out in the field to do risk assessments and remediation in homes of children who have been lead poisoned. And I'm happy to report we just finished negotiations on a $7 million HUD grant. So we're getting an additional $7 million. For some reason, it starts this Saturday, the grant, but we'll take it. We'll go out to do inspections on a Saturday. I'm good with that. So it'll be one more step to making our homes and our residential spaces as lead safe and lead free as possible. Next, please. So addressing the gap and working towards the safest, cleanest, greenest, and economic opportunity for all. We've identified the funding to build the 2 new health centers. One is at the Frankfurt Transportation Center. The other is at the Friends Hospital campus. These sites were chosen after years of searching. The FTC site is a part of an infill development and has been championed by the Frankfurt CDC. This site will be able to see about 16,000 patients per year. It'll be on the first floor of the site, and there will be a grocery store next door. So we're trying to have a sort of a holistic approach. The Friends campus site will accommodate about 30,000 patients per year, and both sites have been have the support of council and numerous community members. And while there was some opposition, we cleared all of those hurdles. Together, these sites will help meet the care gap in the lower Northeast, and the revenue, this is the lovely part of it, the revenue from these sites will more than pay for their operations. Next, please. So what drives our decision making? You know, what makes us choose, what helps us to decide what we're going to focus on? And it's really our surveillance data. So our Division of Disease Control tracks everything. So we look at that and are mindful of that. Our community health improvement plan, our SWOT analysis from community partners, and then we conduct all staff surveys. One of the things, as someone that's come up through the ranks, I can tell you, the boots on the ground, the staff that are going in the field day to day are the best indicators of where we can improve our operations. So the process is really, what are the major causes of years of potential life loss in Philadelphia? What public health problems are decreasing our ability to thrive in our city? What are the determinants of health and how can we impact them? And how can we do our work more effectively? So what can we do? If we have our Lead and Healthy Homes team going into a home to help a client, do we also see if our maternal child family health team can also join them? So maybe we can do some of that education. So really looking at efficiencies across the board. Next, please. So the things that drive decision-making for me, it goes back, this is a health impact pyramid and had a significant impact, right? We know that at the bottom of this pyramid, if we could solve the issue of socioeconomics factors such as poverty, for making sure everybody has equitable education and inequality, we would then probably solve our public health issues. But again, to reiterate, public health is a basic human right. And since we may not be able to address that aspect, though, I will say the mayor and the team is really working on with our Department of Commerce to create opportunities for entrepreneurs and small businesses to create that economic opportunity. We as a health department can have our piece in that as well. So the other drivers of change that have larger impacts are changing the context and to make the individual's default decision to be healthy. So fluoridation, zero trans fats, iodization, smoke-free laws, and tobacco tax. And then long-standing proactive interventions would be immunizations, brief interventions, cessation treatment, colonoscopy, and then clinical interventions would be prescriptions for high blood pressure and cholesterol and diabetes. And then education is really convincing folks to get physical activity and eat right. Next, please. The other things are equity in public health and focusing on the essentials of public health service, and also looking at the interplay between the individual, the society, and the environment, and how when we impact ourselves and our small community, how that ends up overlaying or how that is nested within the overall environment and how we have a direct correlation and impact. Next, please. So for me, the other three things that I'm always mindful of, and these are my three pillars, and we've had our staff town halls and I've gone through these and I keep going through them. My public health journey has really established these three pillars for me, which are integrity, being transparent, being honest. Being honest enough to say, I don't know the answer, but I will get it back and I will get it for you. Acknowledging and, making folks realize that there's a whole team of public health subject matter experts that are within the department that lend support to the great work that we do. Commitment. Public health can get very hard sometimes. And if you don't have the passion for public health and the passion to do this work and you're not committed, it can be very challenging. So it's important to have commitment. The folks that work in the health department, I have yet to meet a more committed group. Day in and day out, whether it was COVID or anything else, most recently, the things that our city's been impacted, they just step up and step in and do the work that they're being asked to do. And then lastly, accountability. Accountability is key. I have to be accountable to you. You have to be accountable to me. And at the end of the day, we're accountable to the Philadelphians that we serve. Next, please. So for environmental justice and children's environmental strategies, our focus is on asthma. Asthma affects about 1 out of 5 children in Philadelphia. It's a major cause of missed school. And then lead poisoning, 11% of 3-year-olds had ever had a high level, and we know that no level of lead is safe. And we still have 2% of our kids that have lead levels over 10 micrograms per deciliter, which is too high. Indoor and outdoor air quality, which affects asthma and a host of other challenges. We know that we experienced firsthand what we went through with the wildfires and how those fires and the smoke came in all the way from Canada to us. And so we have to be mindful of that. That's one of the reasons why we established the AMR6 regulation through our Air Pollution Control Board. And basically that regulation requires hazardous pollutants to be passed. It was passed in 2023, and it requires that those Title 527 companies in our city that potentially emit toxics into the air have to have mitigation strategies and be able to run background to make sure that they're not releasing things that are cancer causing. We are also working on a multi-stakeholder planning process for asthma, tobacco, using tobacco, and monitoring tobacco use during postpartum. Lead in Healthy Homes. In 2019, as I mentioned, we passed the lead law, and we decreased the threshold for home services to 3.5. And with the passage of the lead law, we've had over 100,000 lead certificates, which means that those spaces are lead safe or lead free. And it's very unlikely that children living in those spaces will end up getting lead poisoning. Next, please. Heart disease, cancer, chronic disease. PDPH takes a policy systems and environmental approach to non-communicable diseases, such as which cause about 70% of deaths. The top underlying cause of death in the city is tobacco use, about 3,700 deaths a year. And we are working on a multi-stakeholder plan to address smoking postpartum. We also, our chronic disease prevention CDIP division and our environmental health services division work on outreach, education, and enforcement, specifically for those folks that are selling tobacco to minors. We do everything from youth sales tickets to taking places to court and using our full authority with a complement from authority from our Department of Licenses and Inspections in the city of Philadelphia to cease operate establishments that are repeat violators. And that goes a long way because it sends a message. If you sell tobacco products and try to engage our youth in this, this unnecessary habit, that we will take action. We work with other city departments to identify opportunities and more attractive to be active in city neighborhoods, working with other city departments and agencies to decrease the number of city residents without access to running water. We know that, again, water is a basic human right, and we've been collaborating with Philly Counts community health workers to reach out to those folks that are threatened with shutoffs and to assist them to apply for assistance programs. Next, please. So I'm a big proponent of working with groups and collaborating. So one of our first tasks is working on collaborations within our PDPH divisions to align with the department's mission and the city's vision. Some of the recent examples are the way that our teams funded and responded to the Code Blue and the plane crash response. Right away, we had our air management services team go out there and grab air samples to make sure if we have to message the residents about anything associated with air quality. Our Office of Facilities Management stepped in and made sure that our health center, our lonely health center on Cottman Avenue, was not impacted. And our medical examiner's office went into action and did what we needed to. We also work in collaboration across city departments to achieve needed support and to carry out PDPH's mission and the city's vision. So some of the examples of this are our rodent survey project that we're going to work on. It turns out that there are rodent rat infestations, and it really needs a comprehensive approach. And this goes back to methodologies that CDC had in place many, many, many years, decades ago. And so we are reinvigorating those, and that requires support from the streets department, the water department, the Councilmanic district. And so we're working collaboratively with all of those folks so that we can roll out a comprehensive program. And really, public health is about empowering people so they can take care of themselves. So really teaching folks about what they can do and how they can protect their home and how to properly store their trash and all of those things, and then baiting and treating for things so that we don't have rat bites and other things. Also, our response to Bartram Gardens and the remediation plan of Alliance Chemical Company, and working with our water department, working with the State Department of Environmental Protection and the State Department of Health to make sure that we were providing guidance and facilitating the conversation for the community as well as the gardens themselves. Next, please. So where does the Board of Health and PDPH? This is a partnership. I mentioned earlier on that how humbling it is for me to be in this role as health commissioner, as someone who has experienced direct impacts of the amazing legislation that has been passed by, not regulation that has been passed by the Board of Health. Throughout the decades of my career, it is a partnership for us to meet and look at, what are the public health issues that are impacting us and what are all of the tools in our tool chest to make meaningful impact and make meaningful change. And so the Board of Health approves and promotes health regulations for the Department of Public Health, and these regulations establish standards to control public health hazards and protect the health of Philadelphians. One such regulation, I don't know if anybody else was still on the board at that time in 2012, when we passed our outdoor feeding regulations to make sure that folks that were hungry had a dignified experience and got to eat healthy, safe food, because food is a basic human right. So just because you can afford it doesn't mean that you should be the only one that has access to safe food. We want everybody, especially those of our Philadelphians that are not, that are hungry. 1 in 3 Philadelphia's children go to bed hungry. We don't want that. So the board passed regulations for outdoor feeding of to the public, and we have been enforcing those regulations since 2012. We have an application process. We monitor food safety compliance. We offer training, and we go ahead and make sure that our hungriest, most vulnerable Philadelphians are getting safe and healthy food. And again, board members review the regulations in advance, and our job together, it is my hope, and with community involvement, that we continue this effort to create robust regulations that, while we may lead with education, we know that in order to get marketable public health change, we do need regulation. So I really look forward to our partnership. Next, please. And that's it. So I'll open it up to questions from the board. Yes, Dr. Gold.
First of all, Commissioner, I want to welcome you and express my excitement over your appointment. And I'm grateful for this overview of things that are going on. Specifically, this is very, very helpful, takes us to this point. I know we'll be working on specific areas moving forward, but specifically right now, I can say, you can, I'll go here and say, one of the greatest threats to public health overall that is happening right now involves the new federal administration in just about every single way. For those of us who are been doing public health practice for so long, and we're looking for the sort of silver linings, golden nuggets, but they are hard to find. Specifically, when COVID occurred, we had rehearsed a lot of things with the federal government leading up to COVID, and I know there are some folks listening in from your various divisions on this. We really had no federal government as a partner for quite some time. H5N1, or bird flu as people know it, is right around the bend. I'll just use that as an example. Certainly there are many other issues. And what I'm specifically asking here is, how confident are you? Where are things with local public health in terms of shoring it up? Should the federal well run dry? Should you not get the kind of CDC direction for whatever the reason is? We expect the potential of everything being hit. And I'm wondering if meetings are ongoing and the city is fortifying itself to ensure as many safeguards as possible, given the fiscal constraints and situation that we're in. A light question, Commissioner,
Yeah.
a light question.
Of course, I expect nothing less from you. And of course, we, as you said, we have to fortify. One of the reasons why our division directors are on this call. I remember many years ago where the Board of Health meetings, the division directors all took part in them so that there was a unified approach, right? So the other part of this is that I was here during COVID doing work, taking the hits from the, and as the person in charge of the division that was running around, making sure places were being, following the rules and the guidance, enforcing those rules. It was very challenging. So in the, and that's an understatement, but I will say that we are doing all of the things to fortify ourselves, the mayor's office and the managing director's office. And I believe our deputy managing director is also here, Ms. Yates Gale, and Ms. Coker Clark is her chief of staff. So there's commitment for the Department of Public Health all the way up. When I say public health touches everyone's life every day, that is seen, that is supported. And, there are a host of meetings. So we are internally as a department gathering all of our experience, our intel, kind of steadying our ship the best we can, depending on what ends up in the news cycle the next day. And at the same time, under the leadership of Mayor Parker, there are all host of plannings and meetings and things taking place to make sure that our city is fortified. I think one of the things that has in the month and whatever number of days that I've been commissioner that has stood out to me is from the town hall post plane crash to make sure that our most vulnerable Philadelphians that were impacted and how, whether it was our deputy managing director who stood up and answered questions and got people immediate help, but our mayor who, was very adamant that she was elected in this place and she wasn't leaving. And we didn't leave. We didn't leave that night until every single person that needed help at a 300+ person town hall that needed something got what they needed. So, and not only that, but I was, because I'm always a learner, I'm a lifetime learner. So I was also watching and learning how all of these other different levels of the political structure came in and swooped in to help support Philadelphia. We had representatives, we had people from the governor's office, we had everybody, and they were, both sides of the aisle ready to support what was needed to be done. We even had the DEP director came down just for the meeting, just to make sure that any sort of environmental related concerns that might have been surfaced would be addressed. So I hope that answers your question. I don't have a crystal ball, but I can tell you that we're not sitting idle. We are doing all of the things. We have a lot of
I hear you.
I
want to leave time for other members to ask.
Yep.
I would suggest just consideration, perhaps in your meeting with leaders, that adding a quick line about the commitment of the health department to public health science and the data is an important thing, that all of us together stay focused on the data and the science when we're battling issues such as basic vaccine, whatever it is. We don't need to discuss it here, but that making that a public fact and holding on to it through this maelstrom, unbelievable time, is critical. Public health science is everything. The data is everything. And combating misinformation as we go. I commit to that with my fellow members right here, and I can't say it enough.
And we're grateful for that. And you all are going to be the cadre of additional subject matter experts that we rely on, that we work on all of this together with. Because united, we have our guardrails. We are our guardrails. to help us get through this. Any other questions?
I have. Hi, can I jump in? Sorry. Yeah, thank you so much for that presentation. It was very helpful to hear it. I think, just one suggestion might, I mean, there's a lot of things, right? But one suggestion might be for you as a, new health commissioner to think about what do you see as your top priorities? What, of all the things that are already going on that you're going to maintain, what are the things that you see as um, most important during your leadership of the health department? Um, you know, we could provide some thoughts on that, at some point if it's helpful to you, but I would encourage you to do that, to think about that. And then the other two quick things I wanted to comment on are equity. So you mentioned that several times during your presentation, and I wonder, I'm not sure, but I believe the department may have had a health equity plan, or if not, maybe, thinking about health equity beyond access to healthcare, which is very important and we have to do, but moving beyond the health centers to, the other many things that you know about that are contributing to health equity. So what would be the priorities over the next few years that the department can focus on to reduce health inequities within the city? And and then the other thing is climate. I mean, that's a big thing, how beyond the, disaster response, what can the city do to help prepare and address the climate crisis and its health impact? So just a couple of things to think about, but thank you very much for your presentation.
No, and I appreciate that. And as a environmental person, that is on the equity, and as an environmental justice, environmental health person, that those two things and who gets the environmental goods and who ends up with the environmental bads is always in the forefront of my mind. And so whether it's working with our Department of Prisons to make sure our detention center has adequate mechanical cooling during our heat emergencies, because we know that they come and they're fast and furious. And that's a population that, again, for me, that the notion of equity is built into basic human rights and that health lens. So whether it's creating equitable workspaces internally for our staff, or creating, acknowledging and sharing with other city department leaders about where does equity fit in. One of the things that we're going to be doing is transitioning a lot of our fleet to electric cars. Who would have thought? So our fleet commissioner reached out. He and I we're going to start looking at our health department vehicle fleet to see how we can trade it out. And all of that will positively impact air quality in our city, and then ultimately have positive impacts on other health proponents. And as I work on the clarity of the vision and all of that, for me, as I said, the Board of Health is a partner, and I look forward to gaining insight from you all. Dr. Ibrahim.
Thank you.
So that was a perfect transition. The last part you just said about seeking to work with all of us, and thank you. I do appreciate your remarks. I would say one that I think all of us stand ready to assist, to be a sounding board, to debate, to discuss, and I would just ask that there is that high level of collaboration and that we be re-engaged, because there has been an extended period of time where we want to be helping and have the capacity to be helping. And so, just asking for that sort of recommitment to the collaboration with this group. And then the second question I had, and this came up also in public comment, was just this communication to the larger public. And so I think there are concerns about how we're communicating based on, certainly the issues that you raised this evening, but also communications related to larger issues. We're not hearing that centrally from the CDC, where we know that there are major concerns, whether it is, bird flu and the impact for individuals in terms of accessing eggs. But can you talk a little bit about your approach to the communication to the larger population around prevention strategies, awareness of major issues and the actions that they can be taking?
Sure. So, one of the things that we learned through the pandemic was the importance of communicating out briefly and directly and succinctly to all folks so that, people knew what was going on. Our preparedness group within our Division of Disease Control is actively working and I see our comms deputy directors on the meeting as well. So we are actively working to make sure that those networks that we have used in the past, that those networks are robust and still in place, so that when we need to communicate out, it's a trusted source. So the public knows, okay, I can go to this particular website, or I can text this number, and the information that I'm going to get is directly from the city, and be able to give me the right information for the action that I need to take. So that is one of the venues that we will continue to use. And as we move forward, we're going to make sure we fortify that even more. Welcome. Dr. Brian Stevens.
Yes, thanks again for those comments. Very helpful. You mentioned a couple of things that I just kind of wanted to continue the discussion. And, one of it is collaboration among the different city groups. And I think, we know Mayor Parker made a commitment to 30,000 new affordable or repaired housing units. And as we look at, the incidence of asthma as well as lead poisoning, housing and healthy housing, as you know, is critical. And can you, or have you thought about how you, from the health department, can really inform this new commitment and making sure that when these repairs or when new housing is done, that we make sure it's healthy housing? And there's, as you know, there are specs already for how you do that. And so like how that's incorporated into this plan.
Sure, absolutely. So, and we know all about, you and I have been in the trenches about healthy housing and speaking that with that united voice since 2011.
Yeah.
So, housing is key. It's at that bottom of that pyramid,
Mhm.
And so as the mayor works with the folks at PDIC and other folks, there's new leaders like myself.
Mhm.
We are connecting and having those departmental meetings. We already have a capacity built in with basic systems repair. They know us, and I think you're familiar with that when we come across properties that need that level of remediation work. So these are the sorts of meetings that are going to be slowly being scheduled, with myself and the other leaders, so that they're aware of the resources and what sorts of things that we look at. The commissioner for the Department of Licenses and Inspection, she and I've worked together for years. So having those connections and being able to share information and trusted information in a collaborative space really lends itself to solid work. So I'm not quite there to roll out anything to you yet, but those meetings and those conversations are coming.
Great. I mean, I agree that, we have various agencies across the city who's been looking and thinking about this for a long time. And I think the fact that we have a mayor so commitment is a good time to kind of really do something different and something great, something that we really haven't been able to do before in Philadelphia. So I'm excited about the opportunity and happy to help however I can. My other question, it's a little different. In my role currently, I am, we're focusing on a certain neighborhood in Philly, but what we're noticing is that, there is no really, there's no brick and mortar market that sells fresh foods and, I'm sorry, fresh produce. And so that, really they're limited to what's ever at the corner stores. And I just, of course, food is health, housing is health. A lot of the basic needs are health, right? And I'm just wondering if there's anyone, and you didn't mention it, if you did, I missed it. Was anyone looking at food deserts, looking at ways to work with businesses? Again, thinking about partnerships and collaborations where we bring in businesses who may have something to gain by standing up these brick and mortar places that actually, allow those residents to get healthy foods.
Um, so that's a great question, right? Because again, food and so our Division of Chronic Disease and Injury Prevention, under Dr. Chandriani's leadership, we focus on that. So whether it be farmers markets, and then there's the cross play.
Mhm.
She and Dawn Kieswetter, who is the Director of Environmental Health Services, work together. So not only do we have fresh food and access, but we want to make sure that's safe and healthy, right? And those mean two different things.
Right.
And so this is the kind of work, and this is why I am so grateful and so fortunate to work with these subject matter experts, because they've just in under a month and a few weeks we just have been like connecting and reconnecting and figuring out, where the cross connections are, what can we do? So I know Dr. Chandriani has joined. I'm not sure if Dawn is on, but we will definitely, as a offset of this call, we'll follow up internally and make sure we have parameters in place.
Thanks so much. And my last, I guess, suggestion, and maybe this happens, I'll just go on record as saying is I don't always keep up with everything in the newspaper, on purpose sometimes, but I wonder, and this you may be constrained, and so I understand that but I wonder if it would be helpful for the city to hear from you, from the health department, this commitment that you've talked about tonight to health equity. If there's, I don't know if it's a statement, and again, I'm not sure if you're allowed to do that, but I do think where we are now, the more statements we can make of assurance and helping people to understand that we're still all in the fight, we're still all here to support them would be helpful, to the degree that you can do that.
Yep. And I know that the mayor's office and our law department are working on those things, and our director of communications, Jim Garrow, I see he's joined, and Jim is working on kind of rolling out that plan of those associated, I guess I'll call them meet and greet interviews. I'll spin it and say it nicely.
Okay, thanks.
Sure.
I would just like to come in and I would like to thank you all for your time. I wanted to piggyback on what Dr. Brian Steffen said prior. I agree that there are methods where we could address the lack of food. With that being said, I know there are programs such as Meals on Wheels. We could have community gardens, and they could be partnerships that are affiliated with programs as such to address hunger. So it could assist, a lot of citizens who need food. And I also strongly believe that we should have like community gardens in each neighborhood, just so people can have access to things that they need. But thank you all for your time.
Thank you. I know we're right at the 7:30 mark.
Where do we go from here in terms of meetings?
So in terms of meetings, and correct me if I'm wrong, but I believe we were having quarterly meetings and more meetings, more frequent meetings as needed. And I don't know if I'm accurate in that statement. So you feel free to correct me, but that is the plan. Our Air Pollution Control Board meets regularly because we want to still be aggressive and assertive with our local regulations, as they pertain to mobile sources and everything. So I think that is going to be the plan. And what we'll do is Ben and myself, and I'm going to volunteer Jim Garrow, will get back with a list of potential meeting dates and do invites kind of for the whole year.
Commissioner, can I just ask, in between meetings, how should we communicate with the health department in our role as board members if certain issues come up, certain questions come up? Because quarterly, understandable, but it's a long time period, and it means that our regular meetings can be triggered by public health emergencies.
Correct.
which is kind of a crazy way to move forward, but I totally understand you're facing a lot. How do we reach you, or should we go through someone at the department level?
So you can feel free to email me. I believe everybody has my email address. If it pertains to the board, we have to follow the sunshine rules and the Sunshine Act, and we will do that. We will make sure, that's why Ben will make sure that I mind my P's and Q's and we stay on point. But
Yep.
if we realize that it's better that we do monthly meetings, then we will figure that out. I'm open to that.
Thank you.
Thank you. So if I'm hearing no other questions, it's 7:33, and we will make a motion for adjournment.
So moved.
Second.
All in favor of adjourning the meeting?
Aye.
Thank you. Take
Aye.
care.